Hello, my name is Joe Turner. I am the president and CEO, as well as the co-founder of Exponents. Exponents is a 30-year-old organization. We're located in Lower Manhattan, and we just have an array of human services programs. We started out in 1988 and actually got our footing and our sea legs in providing HIV and risk reduction practices to men and women that were just getting out of prison. And if memory holds its seat, back in those days of AIDS and stigma in advocacy, we were charged to provide relapse prevention techniques. I don't know if you remember the days of the bleach kits, but that's where we got our start. Our signature program was the Arrive training program. We've had over 11,000 people to go through that program. But today, I want to talk about what grew out of that early engagement, what is blossoming, what is taking foot now as a revolutionary approach to engaging folks that were traditionally written off. And that is, as we all know, harm reduction and harm reduction engagement. And, I mentioned back in 1988 how we were providing these services, but it was such a crisis situation that we could not wait for people to become abstinent in order to provide these life-saving services. We didn't call it harm reduction back then. We called it meeting people where they are. But really, it was meeting people where they are, but not leaving them there. So abstinence was not a requirement to get into our program. It was not a requirement to remain, nor was it a requirement to complete our programs. And that was our early setting. But as we see around us now, this harm reduction engagement, which some folks have called patient-centered, that even that word patient sort of rings a bell of hierarchical stigma. But harm reduction is really a set of strategies and ideas aimed at reducing the negative consequences of drug use. And we want to reduce not only the harm that drugs do to people, but harm reduction also seeks to prevent the harm that society inflicts on individuals. Look, we take an holistic approach. You can't provide SUD treatment only in a silo of behavioral health. The intersection of race and inequity, even now with the overdose crisis, how the pandemic affected that, all these intersect with each other. So harm reduction looks to provide services to the whole individual. And I'll talk more about that later. But it's an exciting and very engaging pathway to SUD treatment. So what is harm reduction? Also, in the words of people that are most affected by it, in the words of our clients, harm reduction, to them, some folks said it's keeping people alive without judgment and without condition. That harm reduction is compassionate engagement. I said meeting people where they are. It's affirming and celebrating any positive change in the individual's behavior and lifestyle. A good friend of mine, Joyce Rivera from the St. Anne's Corner Project, she says harm reduction is mercy. Simple, just like that. It's the ability to see recovery in the eye of every drug user that walks into. Can you do that? And a good friend of mine says that harm reduction is radical welcome. You see where I'm coming from. We're looking past stigma. We're looking past the present status of the individual to see them living a self-directed life and not putting up a bar of you must do this in order to get there. And lastly, I would say that harm reduction is science. The data supports it. It's not ideology. These are evidence-based strategies of effective interventions, and they prevent disease, they save lives, they improve health, and most of all, they ignite hope. Can you dig it? Oh, I know you could. And interesting enough is that harm reduction really finds its foundational concepts in 12-step programs. How can you say that? 12 steps, harm reduction, some folks think that they are philosophically opposed. That is not the case. The early days of Alcoholics Anonymous provided the concept of one alcoholic talking to another, a peer-directed concept. And that surely met people where they were. In the early days of AA, they had what they called 12-step calls. That's where someone called up the AA office and said, look, I have someone in my family who's drinking. Their lives are being shot to hell. I need some help. They would dispatch 2 members of AA. And on the way there, in most cases, they would stop by a liquor store, buy a half a pint of whatever, took it to the person's house, and because if the person was in DTs or was shaking, before they could even provide the message, they would give them a bit of alcohol just to calm them down. Now, if that's not harm reduction, I don't know what is. That concept of community, of the unparalleled love of one alcoholic helping another, found its way even into therapeutic communities. I know we sometimes have a revisionist attitude where we look back at some of the abuses of the therapeutic community, but in that concept was the fact of, someone said it was the inmates running the asylum. These communities were administered by people who were using drugs. It was self-directed, it was peer-directed, and the beauty and love of that came out in the community concept of that. And we talked about how in the early days of the HIV crisis, Exponus, we took a lot of our lead from the gay community in terms of their response to the AIDS crisis. In fact, they organized, they did a hell of a lot of advocacy, and they also gave the message that, look, yes, HIV is transmitted through sex, but they didn't tell people to stop having sex. God forbid. No, they said have safer sex, reduce the harm. They mobilized. They mobilized around cures. They advocated for the rights of people to not face the barriers of stigma who were living with HIV. And we said, wow, we like that. And we're gonna do the same thing with people that are using drugs. So hence arose our compassionate engagement. And I think that is proliferated into harm reduction, which is not just one approach, but it's a continuum, and it's an array of responses. I must just say this before I go into the next item of discussion, and that is we also see harm reduction as tied in the disparate responses to opioid use and substance use disorder. If we look at how society responded to the crack epidemic was one that was looked at in society without compassion, without blame. They were using words such as crackhead, crack baby. How vile is that? The response was not a public health response. The response was mass incarceration of Black and brown people. And so we see the difference in the response now, where addiction and where substance use disorder has found its way into other communities. Now the response is compassion. Now the response is, I heard someone say that, when folks talk about the prescription pathway to substance use disorder, it was accidental. it was blameless compared to those who have used illicit drugs. And hence you had two different systems of response. They're looking now at a public health response because the face of recovery was different than the face of the crack addict. So we need to recognize it, we need to name it, and so it is not repeated. So harm reduction, as it is now, is indeed a continuum that can begin with safer use. We see the number of syringe exchange programs, which have been scientifically proven, and the data shows, the research shows that they do save lives. They do prevent bloodborne diseases. So we look at safer use, right? We look at managed use, and we also look at medication-assisted treatment. These are all alternatives to abstinence, which is actually a black and white, all or nothing situation. And in terms of medication-assisted treatment, of course, we have methadone, buprenorphine, Suboxone. All of these permit many, many people to live productive lives without without the demands of abstinence. And for some, it was either abstinence or death. We're also seeing the proliferation of harm reduction drug treatment. We have a harm reduction drug treatment program at Exponents. I'll talk a bit more about that later, where we don't, we look at our language, we don't use words such as relapse and addict and those filled with judgment, but we look and celebrate every positive change in behavior. And we've had some astounding results with that. And I'll say that the continuum of harm reduction begins with engagement, outreach. It then does go to safer use, managed use, and check this out. Sometimes abstinence can be a goal of harm reduction, as long as it is chosen by the participant and not imposed upon him. And then lastly, we see the philosophical approach of harm reduction being embraced by many traditional legacy abstinence-based organizations. SAMHSA, their definition of recovery, it goes something like, I think they say it's a process of change through which individuals improve their health and wellness and live self-directed lives. That definition, I'll give you $10 if you can find drugs or abstinence anywhere in that definition. It's not there. They're looking at progress as a spectrum of wellness. Also, I need to applaud Oasis and their recent 822 regs that also indicate that the goal of treatment is not abstinence, but the goal of treatment is recovery, where we need to interrogate the health of the individual, employment, equal opportunity, equity at all levels are tied to recovery. There's a great saying, and I ask you to, if you can get a chance to look at some of the writings of Bill White, where he talks about radical recovery. He talks about it beginning with the self, and then the recovery extends to the family. But it does not stop there. It goes to the community. Our Native American brothers and sisters, there's a program called Wellbriety that's run by Native Americans. They have a beautiful saying. They're saying that the individual, family, and community are not separate. They are one. To injure one is to injure all, but to heal one is to heal all. So harm reduction moves the healing from the self to the family and to the community. That's why Black Lives Matter. That's why gender equity. That's why income equality are tied to recovery. I would say that harm reduction recovery, we realize that recovery is a gift. And with that gift, it brings obligations that transcend the self. Many of us make amends to our community. How do we do that? By seeking social justice. Harm reduction, it interrogates these institutional and community barriers so that we can have a full recovery. Structural racism, gender inequity, all these inhibit and exacerbate substance use disorder, and they inhibit recovery. So, harm reduction exponents, we target the dismantling of these structural barriers as an amends to our community. So, I don't want to take up too much time, but I want to bring just an overview. There's so much more to unpack, but I see it as paving the way. I see it as the preeminent approach to substance use disorder. Not just that I'm saying it, but the data supports it, from syringe exchange programs to overdose prevention centers to medication assisted treatment. So I want to thank you all, and remember that changing oneself and changing the world are synergistic. Thank you very much.